Hello everyone. So today we are going to talk about one of the frequently asked question about that is about difference between true labor pain and false labor pain. And so let's start and in the talking about first difference about the uterine contraction. The nature of true labor pain is that there is in true labor pain there is regular rhythmic contraction of uterus that is on and off type. There is painful uterine contraction at regular interval. This point line is very important. It is a regular and rhythmic. In the true labor pain, the uterine contraction is regular rhythmic and it is on and off type of pain. And whereas in false labor, the uterine contraction is irregular and continuous type, and the pain is dull in nature. So that's why the oxytocin also produces the rhythmic and regular contraction. That's why it can be used for induction and augmentation. And the nature of the uterine contraction is it is progressive type of contraction. There is in the true labor pain there is increased intensity, increased frequency, and increased duration of the contraction, and it increases progressively. Intensity, frequency, and duration of contraction increases with time progressively, and there is no such feature in the false labor pain. And the cervix shows progressive dilatation and effacement, and there is progressive effacement and dilatation of cervix in the true labor pain, whereas no such feature of the cervix in the false labor pain. And the site of pain is lower abdominal pain with that radiates to the thigh and the back, whereas the in false labor pain that is it is localized to lower abdomen and groin only. There is no radiation. And so what is so is the blood that is mixed with the cervical mucus, and this is present in the true labor pain. This is there is that, and there is no soap in the false labor pain. Bag of pour water is felt in the true labor pain, whereas no bag of water is felt in the false labor pain. Let's talk brief about what is sow and bag of pour water. The sow means with the onset of labor there is profuse cervical mucous discharge. Simultaneously there is slight oozing of blood from the rupture of capillary vessel of cervix and from the raw decidual surface caused by the separation of membrane due to stretching of lower uterine segment. So the expulsion of cervical mucus with that is mixed with blood is called sow, and it is present in true labor pain. And in the bag of pour water means that due to stretching of lower uterine segment, the membranes are detached easily because of its loose attachment to the poorly formed decidua, and with the dilatation of the cervical canal, the lower pole of the fetal membranes become unsupported and it tends to bulge into the cervical canal, and as it contains liquor which has pressed below the presenting part, and it is called as bag of water. And during uterine contraction with subsequent rise in intra-amniotic pressure, this bag becomes tense and convex, and after contraction it passes off. The bulging may disappear completely, and this is associated with regular contraction, and cervical changes are sign of onset of this in association with regular contraction, and cervical changes are onset of labor. So that was. And the pain, true labor pain is relieved by enema and sedative, whereas the false labor pain is relieved by enema and sedative. So that was all. Thank you, and we will come up with new topic in next video.